President Biden is urging the millions of Americans who are now eligible for a COVID booster shot to get the added protection against the virus. Overnight, CDC Director Dr. Rochelle Walensky signed off on a series of recommendations made by an advisory committee. But in an unusual move, she also put back in the recommendation for a third dose to individuals whose jobs might put them at risk, such as healthcare workers.
As CDC director, it's my job to recognize where our actions can have the greatest impact.
Moderna is in the process of seeking FDA authorization for a booster shot, and Johnson & Johnson is expected to follow suit soon. The administration's health officials hope to make additional recommendations in the coming weeks. And our in-depth coverage of booster shots continues now. Thousands of eligible Rhode Islanders can now get a Pfizer booster shot. This following the FDA and CDC guidance overnight, backing that third dose for millions of Americans. 12 News reporter Brittany Schaefer joins us now live with what the state's health department is recommending today. Brittany?
Well, Kim, the Department of Health tells me the state is using its current vaccine infrastructure to administer those booster doses. It's why the state was ready to put shots in arms just hours after the CDC released their guidance.
People are getting booster shots right now as we speak.
130,000 Rhode Islanders are now eligible to get a third dose of the Pfizer vaccine.
We are prepared at all of our state sites and municipal partners.
The Rhode Island Health Department is recommending boosters for people 65 and older, as well as people of all ages who live in long-term care settings. They say people ages 50 to 64 with underlying health conditions should get the booster, while people 18 to 49 with health conditions may get the additional dose after talking with their doctor. The state also recommending the booster for people 18 and older who work in a high-risk environment like healthcare, prisons, or homeless shelters.
Some people, they just don't mount the same level of immune response that people with a normal, healthy immune system would. And so this includes people that are older.
The third shot is given 6 months after eligible residents received their second shot of the Pfizer vaccine. Health Department Consultant Medical Director Dr. Philip Chan says the demand for the vaccine is expected to be higher now than it has been in the past 6 months. They are highly encouraging people to make appointments.
Every little thing we do helps. And so I do think the boosters will significantly contribute to getting closer to ending this pandemic for sure. But again, really the bottom line is everyone needs to be vaccinated.
And the current guidance only applies to people who have received the Pfizer vaccine. The CDC has not approved a booster shot for people who have gotten Moderna or the Johnson & Johnson vaccines. For now, live in East Providence, I'm Brittany Schaefer, 12 News.
At 6, the rollout of booster shots is underway in southern New England. CBS says it now is offering third doses of the Pfizer vaccine to people who are eligible. And the Rhode Island Department of Health says it's ready for an increase in demand. 12 News reporter Brittany Schaefer fills us in on who can get the boosters and where. Brittany?
Well, Kim, late this afternoon, the health department announced booster doses are available to eligible Rhode Islanders now. Governor Dan McKee tells us the state will continue to be a leader in vaccinations. Just hours after the CDC's approval, Rhode Island is ready to put booster shots in arms.
We've been ready to go for a while now, and we're leveraging our existing infrastructure so people can show up to any of the vaccination sites to receive a booster for Pfizer.
Governor Dan McKee and the health department is recommending boosters for people 65 and older and anyone living in long-term care settings. They say people ages 50 to 64 with underlying health conditions should get the booster, while people 18 to 49 with health conditions may get the additional dose. The state also recommending the booster for people 18 and older who work in high-risk environments like healthcare, prisons, or homeless shelters. Under these guidelines, around 130,000 Rhode Islanders are eligible. The governor releasing a statement this afternoon saying, quote, "We had the infrastructure and strategy in place to respond swiftly to the approval from CDC, FDA, and ACIP and ensured boosters could be administered as soon as possible. Rhode Island continues to lead the nation in vaccinations and testing, and we will continue to lead as we begin administering booster shots." The third shot is given 6 months after eligible residents received their second shot of the Pfizer vaccine. According to the state's plan, boosters will be available at pharmacies, municipal clinics, and through primary care providers, as well as through targeted efforts in certain communities to meet people where they are. The booster only applies to people who received the Pfizer shot. The CDC has not authorized booster shots for the Moderna or Johnson & Johnson vaccines.
Every little thing we do helps. And so I do think the boosters will significantly contribute to getting closer to ending this pandemic for sure. But again, really the bottom line is everyone needs to be vaccinated.
And according to the health department, demand for the vaccine is expected to be higher now than it has been in the past 6 months. They are highly encouraging people to make appointments. Live in studio, I'm Brittany Schaefer, 12 News.